Good morning, everybody. I'm Mona Sarfati, a family physician and a public health physician from George Mason University, where I direct the program on climate and health that's part of the Center for Climate Change Communication, founded by the communication expert Ed Maybach, who you'll be hearing from later today. This is almost exactly 1 year after the big demonstration in New York last year. I know many of you were there. And this is the beginning of a historic week here in Washington, D.C., with the Pope coming for the very first time to address Congress, bringing messages that are based not on self-interest, but on morality and ethics. And this is something I believe we as health professionals all share and will also be bringing to Congress and to others as we learn more and share what we know. This meeting is in fact a historic event itself at the beginning of this historic week. It may be the first time that there's been an all-day continuing education event devoted to climate change and health for health professionals across the spectrum. While there have been workshops for particular disciplines, like pulmonologists, or on particular conditions like asthma, this is the first open all-day education meeting focused on climate change and health, and so we're excited to make history. But this must be the beginning of many more education and activation sessions. The need for this type of event was made clear to me by 3 surveys we did at George Mason with 3 different medical societies. To our great surprise, only 40% of those who responded thought they were well informed about climate change and health. Another 40% indicated that they were only modestly well informed, and 20% felt that they were not at all informed. 2 national meetings earlier this year in March and June also identified more education about climate and health, as well as advocacy training as high priorities. I'd like to thank Eco America for their role in getting those meetings planned and launched. Through public polling carried out by George Mason and Yale universities, we know that most people still don't make the connection between climate change and health. We also know that most people are not even talking about climate change. In fact, too many people still see climate change as something which is distant, has little to do with them, and is unlikely to affect them, or affect them only at some point in the distant future. Health professionals are a perfect group to change that. Many of us will start tomorrow with the staff of the legislators we visit, but we need to go much further than that. Most of the action on reducing carbon pollution in the air is now moving to the state level. That's where plans will be considered, implemented to reduce carbon dioxide. The goal is 32% reduction by the year 2030, and many of us who wish to be involved will need to be involved at that level. The good news is that we note that the core messages about the connection between climate change and health and carbon emissions is now a central part of the story carried by the administration and the EPA as they try to make sure that these policies are actually implemented. Many of us have been working to include the health message in this story for a number of years, so that's a success. Since that work started, the weight of the evidence about health harms has only become greater, and now's the time to follow through. So, back to orienting you and thanking all of our sponsors. It's my pleasure to thank the organizers of this meeting, Physicians for Social Responsibility, George Mason's Climate and Health Communication Programs, the Association of Nurses for a Healthy Environment, the Public Health Institute, and we've been in touch on a frequent basis, to say the least. I want to thank the staff of these organizations and the many volunteers that joined us, many of whom are here today. We've worked with the support of Eco America, APHA, and 20 other health organizations who are sponsors of this event. We thank them all. And of course, I want to thank all of you for committing your time to come here on a Sunday, learn more about the issues, become involved in educating and activating others. This kind of collaboration and coordination is absolutely crucial. It's at the root of any change. In order to be effective, all these organizations and others will need to be strategically linked, with information, a message, and an approach to maximizing effectiveness at the state level. So to strengthen our connections at the state level, we'll organize lunch by state so that people in different areas of the country can speak to each other. And if there aren't enough people from your state, there should be people, an area where people from your region can have that conversation. So to brass tacks, and before I go to brass tacks, I really should introduce Catherine Thomason, who has chaired our committee to organize this event, and we owe a tremendous debt of gratitude to her, and so I introduce Catherine Thomason.
Logistics. It all boils down to logistics. Well, thank you all for coming. It's really delightful to see such a room full of health professionals and advocates who are ready to take charge and to help really move policy, because that is so absolutely essential. We are going to get nowhere if we're not able to do that. I think Mona did most of the introducing, so did you talk about the tracks and stuff like that? Okay. So we organized the day with an organizing group so that we'd have continuing education credits for medicine, for nursing, and for other health professionals. And we did it I know everybody's going to want to go to every single thing, but unfortunately you can't really do that. If you know how, let me know too. We're going to be taping the plenaries, and we'll be taping the first breakout session, which is the direct health impacts. So the direct health impacts are those that hurt us all and are already hurting us all. The second track in the morning is the public health impacts. So it's impacting people who are vulnerable, impacting really all of us, but more so people who are more vulnerable in a more public health way, loss of housing, agriculture, water, those kinds of issues. And then the last track in the morning is the impacts, health benefits, or the health benefits of getting off our addiction to fossil fuels. Those kinds of arguments, if you're going to be speaking with your legislators, if you're going to be speaking with your hospital administrators when you go home, if you're going to be speaking to your clinic staff, and you are in a state that just doesn't really want to talk about climate change, that track might be the track for you, because burning fossil fuels is harmful for our health. And as I like to say, clean energy saves lives. So you may get further with that argument, and you may want to go through that track as well. They're all fantastic. We are going to have people scribing and putting up a summary of the statements afterwards, and the majority of the presentations will be online as well. After lunch, actually during lunch, I encourage people to come into this space with their lunch and meet up with people from their state or their region. We have over 80 people signed up to go on the Hill tomorrow. I'm very happy about that. Thank you for devoting your time. So that people can get to know one another in their own state and work together. We are the health voice. People will listen to us, and you're going to hear about that today, and you're going to hear in the afternoon how to communicate that effectively, how to use that health voice in the best possible way, and what kinds of policies that we could and should be advocating for. So that's the afternoon sessions. And the agendas are the blue sheet. The abstracts are the description of each segment. And then, of course, there's that very important yellow sheet at the back on the right-hand side, which is your evaluation form. And we would like to make sure that you fill that out after each session so that you kind of keep track. And we have a better understanding as we do these in the future, as we encourage you potentially to do these in the future in your hometown, in your state. That will give us feedback on what was useful or not. The materials on the left side, of course, as Mona mentioned, are all our wonderful sponsors, and we could not have done this without all the sponsors who helped financially in putting this on and in providing speakers and a whole variety of ways that they were helpful. And then on the back of that are several handouts that are for how to communicate to legislators, and those sessions will be covered this afternoon. Good? Great. So I think we're ready to go.